everyone, this is Sania from the channel dr.saniaandaamer. So today I am going to talk to you all about depression among medical students. This being the topic of my own research during the medical school and as well as me observing it amongst my peers made me realize how important it is to discuss this topic amongst ourselves and everyone else. The knowledge of this illness will actually give us understanding how to tackle it and how to prevent this illness amongst ourselves, our friends and our family. So keep on watching. Firstly, we all need to know what is depression. According to the American Psychiatric Association, depression is a very serious medical illness. It affects how you feel, how you think, how you act, and how you behave with others. But what we all need to know is that depression is a treatable disease and it is preventable as well. Now I am going to talk to you all about how to identify somebody with depression. Now there are few criteria which help us to identify somebody with depression. For example, number one, the symptoms, and number two, for how long those symptoms are present in the person. Symptoms such as lack of sleep, unable to focus in academics or in work, lack of interest in usual activities, being distant from friends or family, feeling helpless and hopeless, feeling guilty all the time without any reason, feeling worthless. A few very dangerous symptoms such as a suicidal ideation and attempt to suicide as well. And there are many other symptoms as well which vary from person to person. However, to clinically diagnose somebody with depression, we need to know that these symptoms should be present for more than 12 weeks, that is 3 months. These symptoms might be present in some of your friends or in you yourself as well. But if these symptoms have not been present for more than 12 weeks or 3 months, then you can go for counseling. You can talk to your friends about it. I would urge you all to actually talk about these symptoms with somebody who is close to you. However, you need to know when it is time to actually seek professional help. So if these symptoms are present in you for more than 12 weeks or 3 months, so it is important that you discuss this with your doctor and actually seek professional help to tackle your depression. Now coming back to the medical students. The previously done researches and the research that we ourselves did last year in my own hometown Karachi suggested that about 60 to 70% of medical students develop depressive symptoms which last for more than several days. Now this suggests that these students either have developed depression or they are prone to develop depression in the coming years. We also inquired from them that what activities do they do to cope up with depression. So many of them answered, about more than 90% of them answered that they do binge eating, that is eating excessively, not according to the body's requirement, and this is actually leading towards obesity among the medical students as well. Many of them also answered that they take up alcoholism, they take up smoking, they actually take up taking recreational drugs and also getting into extreme religious practices. What does all this data suggest? Now this data suggests two things. Number one, that depression is rising at an alarming rate among the medical community. Secondly, that the activities that are taken by the medical students are just as harmful. So if these symptoms are not caught early on and this issue is not addressed by our society, then we have very drastic repercussions in our future, which will affect the health of our physicians, our doctors, as well as the patient. Now the question arises, what do we need to do about all of this? Firstly, we need to identify somebody who has these symptoms and urge that person to seek counseling and professional help. Secondly, as medical career is a very hectic one, demanding and very stressful. So it is extremely important to keep a healthy and a balanced life. So I have few suggestions for you all. Number one, physical activity. Physical activity is extremely important. Whether you are doing 30 minutes walk, or you are going to the gym, or you are doing any kind of sports that you like, it is extremely important to take time out for physical activity each day. Secondly is eating a healthy and a balanced diet, and taking your meals at the right time. Eating good food actually fuels your body and keep your energy levels to the maximum. Thirdly, getting a good night's sleep. At least 6 to 8 hours of sleep is extremely important, and they help your mental health, and they actually pushes you to be more focused in your academics and in your work as well. Something which medical students tend to forget is that they need to go out with their friends and their family. Yes, it is very important. You should take some time out to spend with your family and your friends, and so that you forget all about your studies and your stressors. So when you get back to your stressful life, you are more focused and you are more concentrating towards your academics and your studies. The last point that suggestion that I have for you all is basically something which has helped me a lot. You all need to stay motivated. Need to remember what inspired you to become a doctor. If you remember that inspiration and you keep yourself motivated throughout the years, that's going to actually help you make better decisions for yourself and for your patients as well. So I hope you all liked this video and learned a lot about depression as well. If you did, then please give this video a big thumbs up and leave your comment below with your suggestions, as well as follow us on Twitter, Instagram and Facebook by the name Dr. Saniaandaamer. Thirdly, please subscribe to our YouTube channel, and we post videos every week, and we love for you to join our little community that we are trying to build over here. Thank you so much for watching.